In 2014, approximately 1.5 million people died of tuberculosis, TB, globally. 450,000, or 30% of those deaths, occurred in Africa, the second highest rate in the world. In 2015, TB became the leading cause of death from an infectious disease worldwide, higher even than HIV and AIDS. And Southern Africa bears the brunt of this crisis. 1/3 of the countries with the highest TB burden in the world are found in Southern Africa. The region has the highest TB-HIV co-infection rates in the world, between 50% to 77%. And inadequate diagnosis and treatment of TB has led to increasing rates of multi-drug resistant MDR-TB in the region, which is much more expensive to treat and has higher treatment failure rates. The rapid spread of TB in Southern Africa has been fueled largely by two factors: the HIV epidemic and mining, which has historically been associated with some of the highest TB incidents. Furthermore, high volumes of cross-border activity driven by informal trade, migration and labour opportunities, especially in the mining sector, makes efforts to control the spread and treatment of diseases such as TB much more challenging. To prevent the spread of TB and address the negative impact the disease is having on its economies and the lives of its people, 4 countries in the Southern African region have come together to implement an innovative, multi-sectoral, cross-regional approach to tackle the epidemic. Lesotho, Malawi, Mozambique and Zambia are collaborating on a unique partnership launched in 2016 to improve the coverage and quality of TB and occupational lung disease services and strengthen capacity in the region to manage the burden of these diseases. The Southern Africa Tuberculosis and Health System Support Project is being initially implemented in targeted high-priority areas such as mining communities, peri-mining areas, transport corridors and cross-border areas. Miners, ex-miners, their families and health workers will directly benefit from the project, especially women and those involved in the small-scale mining sector. The project is coordinated by the New Partnership for Africa's Development, NAPAD agency, and the East, Central and Southern Africa Health Community, ECSAHC, through technical support to the countries with funding from the World Bank. Together, these countries are collaborating on regionally coordinated actions on TB and occupational lung disease control to enhance case detection and treatment success, roll out a standardized package of occupational health services and mining safety standards, improve the quality and availability of human resources in the targeted areas, strengthen diagnostic capacity and disease surveillance, and promote regional innovation through sharing of knowledge and evidence. These collaborative efforts will help to end TB in Southern Africa. Together, political leaders, the health sector, the mining sector, and the labour sector are working across borders in an innovative, proactive, and strategic manner to address TB, save lives, and ensure the Southern Africa region maintains the hard-won economic gains it has achieved over the last decade.